Welcome viewers to another episode of the Refined Skin and Body live sessions, where we bring you Dr. Chirag, who answers questions about procedures that are done at the Refined Skin and Body Clinic across all the branches. Today we have a very interesting topic. It's called weight loss. Some of you have been at a certain size in past couple of years, and you want to reduce, or you have been reducing, and you've carried out some of the weight loss procedures. In particular, today we are talking about the gastric sleeve versus the gastric bypass. What do they mean? Are they similar? What are the procedures involved? What are the risks involved in both procedures? I welcome you, Dr. Chirag.
Thank you. Good morning, viewers.
How are you today?
Good. How are you?
I'm fine, thank you. So our first question, or my first question for today's live would be, what is a gastric bypass? What is gastric?
Okay, so gastric is your stomach. Let's simply put. Let's talk about weight loss. People have tried diets, tried medication. At the clinic, we also offer weight loss medication, injections, and the balloon.
Gym.
Yes, workouts. So but there's people who are not suitable for that, or have tried everything and now want to go for more of a permanent procedure, which is the surgical intervention. So if I do a simple drawing, hope you can see that's your food pipe, your esophagus when you swallow food. That's your stomach. Okay, and then that's your intestine. So when you eat food, it starts settling down from the bottom part of the stomach. When food gets full, it gets to the top of the stomach, expands it, and sends a chemical off to the brain that now you've eaten enough. So you're full. Now in gastric surgery, this is the stomach. The first one is the gastric sleeve. The surgeon comes in, keyhole surgery, so there's not big open. What they do is they cut the stomach. About 80% of the stomach is cut off. So that part is cut off. Okay, that's taken out. So you have like this banana-shaped stomach now. That is called the gastric sleeve surgery. On the other hand, you have the gastric bypass. So the esophagus, the stomach again. And this is the Rho and Y gastric bypass. They attach part of the stomach, so they cut through here and they do a bypass and connect straight to part of the intestine. So they bypass the whole stomach, as it said, the whole thing is taken away. So basically it's like just a long tube now.
Wow.
From mouth to anus.
So which one is more effective, the sleeve
or
the
bypass? They're both indicated for different things. Gastric bypass is for patients who require more weight loss, are morbidly obese, very big. So this one is more complicated to do, but leads to higher weight loss. So it's reserved for the people who really, maybe you're 200 kilos plus, who need to lose a lot of weight. Gastric sleeve, on the other hand, is not as invasive. They're both invasive, but it's not as extensive.
And not as risky.
Not as risky. Both have the risks, any surgery does. But this is usually for people who want to lose that weight, are overweight or obese, which is calculated in the index of your height and your weight. But for those people who need to lose quite a lot of weight, but are not as morbidly obese as somebody who would require the gastric bypass.
For viewers that have been following the Refine social media handles, over the last couple of days, we've seen pictures of Dr. Chirag being compared when he was, this weight, and now he looks, model-like.
Lost 35 kilos, yes.
Model-like right now. And I want to, there's a question that's been ringing in my mind after this explanation. Why is it that weight loss is associated with stomach weight loss? I could have big legs, I could have big arms, I could have a broad neck. Why is it that weight loss, one of the ways to tackle weight loss is by going for a gastric sleeve or bypass, which only affects the stomach? What about the other body parts?
The weight loss procedures will make you lose weight all over.
Okay.
You can't restrict it to a certain part.
But why is the
when
stomach?
You want to, it's all over. The stomach is, one of the biggest places you store fat, especially in men. So you observe it there. Women, it's usually the hips and the breasts. So you may notice that reducing as well. But with weight loss procedures, whether it is the injections, the balloon, the surgeries, you can't control where you lose it from. If you would like to change certain parts of your body, whether it's the legs or the calves, then there are different procedures. You can do liposuction, you can do weight loss, body contouring injections, fat dissolving injections, fat freezing treatment. So there's different modalities and options for that. But the weight loss procedures that we're talking about today, you cannot control. I cannot control, neither can the doctor, neither can you control where the weight is coming out from.
Yeah. True. So what are the different recovery times for both these? I can understand from your diagram that you have drawn us. Maybe you can show the viewers just one last. This is the gastric sleeve, and this is the gastric bypass. From these two diagrams that you have drawn, what are the recovery times for each? So I'm guessing this takes a longer recovery.
Correct. So the gastric sleeve usually requires 1 to 2 days in hospital where they're managing you for the pain. Recovery from that usually 1 or 2 weeks before you return back to work. For the gastric bypass, it's a bit more extensive, usually about 3 or 4 days in hospital because they need to keep checking your bloods, making sure your pouch is not leaking. And then usually return back to work in 2, 3, 4 weeks. So recovery time is longer. In terms of post-procedure care, with terms of food, you have to be more careful after the bypass because things such as called dumping syndrome, where if you overeat, all that food suddenly coming into the intestines can cause sweating, blood sugar fluctuations. So those are problems that can happen more with the bypass. And also with the bypass, you need more lifelong nutrition supplement because you're really bypassing the stomach and part of the intestine, which is responsible for digesting the vitamins and minerals that you need and absorption. You're not able to do that, so you need to supplement long term with the vitamins and everything.
With the vitamins and everything. At Refined Skin and Body Clinic, I believe these two procedures are offered at the clinic, right?
We don't offer them at the clinic because this is an outpatient clinic. However, we do the consultations, post-op care here. We work hand in hand with surgeons who do these procedures at other hospitals around Kampala, which is up to the patient's preference where they would like to go, what their budget is, but we don't restrict. The surgeon works with certain hospitals where he prefers and takes them there. But it cannot be done in an outpatient setting. You need a full-fledged hospital to work with.
Okay, so the role of Refined Skin and Body Clinic within these surgeries is just to recommend and
but what I would like to tell my patients is before you decide on whether the surgery is right for you, you have to counsel, go through the pros and cons. Maybe surgery is not for you. Maybe other alternatives are better suited, the non-invasive ones. So we guide you through that process. We have a nutritionist on board here who then manage you through your recovery and after, because it's a lifelong change. So that's where I think the surgical part of the operation is a small element of the sort of weight loss journey. It does require interaction with the doctor, with the nutritionist for long-term recovery and optimal health.
Okay, you've mentioned that before you advise someone to take any of these procedures, you have to check them, and this couldn't be for them. They could need maybe just going to the gym or being on a stricter diet. So at what point do you conclude to tell someone that surgery, everything has failed, surgery is the way to go? At what point?
See, first we have to show somebody's motivated, that they have tried to lose weight despite the surgery. It's not an easy way out. So they have to try simple nutritional engagement, exercise. They have to show that they've lost some weight on their own, they're motivated. Then we work them up in terms of their medical conditions. So do they have any heart issues, lung issues? We do a full set of blood tests to make sure that they're fit to undergo the surgery, for example, because if they've got a lot of risk factors, maybe the anesthesia, because it's done under general anesthesia, the risks are too high for them. Then we look at the long-term risk-benefit ratio. Are you diabetic? Are you hypertensive, high blood pressure? What is that going to mean for you in the future? Will surgery resolve that for you? Or are you going to have that surgery done and simply just go back to drinking lots of alcohol, which we have a big problem with in Uganda? So if that is going to be the case, then surgery might not be for you, because then the complications may arise that you are not ready for. So it really does require a lot of psychological intervention before we take you through that path.
Exactly. Now I'm going to put the spotlight on you and your weight loss journey. What procedures did you, or what routines did you follow to lose that amount of weight? Did you go for this gastric bypass and gastric sleeve?
I would have loved to, but what happened was way back in 2013. I mean, I've always had a weight issue, fluctuating throughout my life. I would put on weight easily, lose weight easily. My biggest issue was food. I'm a foodie. It's like my food. So I tried back in 2014, I believe, was the gastric band, which is another procedure, but no longer done, so not recommended anymore.
The gastric what?
Gastric band.
Gastric band.
Gastric band is no longer recommended or not
Why?
done as much because it has high complications. So what that was, that's your food pipe, that's your stomach.
Stomach.
Again, keyhole surgery, what would happen is the surgeon would come in and put a band around here.
Oh.
A silicone band.
Oh.
So this can be, I mean, if you look at it, this would then be tightened. As you tighten it around the stomach, it makes this pouch smaller. So all you could eat was that, and then it slowly the food would go through. So this was the gastric band surgery. It was connected under the skin with a port, which you could then fill up this balloon to tighten it or loosen it. So I had that done. It worked very well for me. I kept it in for about 4 years, lost quite a bit of weight, but then at some point I took it out because I was tired of it.
Yeah.
I was missing my food. So I got it taken out. And then I started putting on weight. At this point, I dropped down to about 80 kilos, and then I went up all the way to 115.
Oh, wow.
So I put on quite a bit of weight in about 2 years.
Yeah.
Then I started the weight loss injections, which I was doing for about 1 year, the semaglutide or Ozempic.
Did simpler procedures come to your mind, like
Correct.
the gym?
Correct.
Why did you go for the extreme?
It's work,
Under
life
the knife.
schedule, motivation.
Yeah.
So that was there for me. So going through the gym was there. I tried it.
Yeah.
The diet. My biggest problem was the food. So these weight loss injections that I did, semaglutide, which we have here a lot of patients on, would help you curb your appetite. It's available in a lot of places, these injections. It's available, obviously under the guidance of a medical practitioner, and it would help you curb your appetite, start using up your fat as an energy source, so that's what I did. Surgery is there, but like I said, I was 115 kilos. Had I been about 130, 140 kilos, then maybe I would have opted for the surgical route, which would have been more permanent procedure.
Interesting. So doctor is a very big risk taker. I mean, you've gone through very
I go
risky...
through them. So a lot of the procedures that I offer here, I do practice on myself.
Wow.
I try them out.
Wow. When someone goes through the gastric, if someone has done a gastric sleeve or a gastric bypass, are there any routine activities they're supposed to do maybe after X months? Is someone supposed to be like go to the gym rig to maintain that?
So yes, you're supposed to work out because we are reducing your calorie intake by doing the surgery. But by doing the exercises, you're preserving muscle mass. So it's recommended to exercise. It's not. It keeps your your heart healthy, keeps the blood pumping. So it's not that you do the surgery and go and sit on the sofa and enjoy it.
But it's a permanent procedure. So why would
it's semi-permanent because if you go back to bad habits, you can actually expand these pouches. This stomach that we've done, stomach is a muscle. If you're not careful, this stomach can expand again. In which case you'll put on weight again.
But you've taken this part out.
You've taken the part out, but the stomach, now you see after the surgery, you've got this food pipe, you've got this small sleeve, okay? So this part has come out.
Yeah.
Now this stomach being a muscle can expand again if you're not careful. So again you can put on weight over time.
With the sleeve, but what about with the bypass?
With the bypass also, it's possible. This whole, it's more difficult, but you can end up with something called mega esophagus if you overeat. All this can expand again. It's all muscle. The way you go to the gym and work out and your muscle expands, so can this. So you have to be careful. In terms of returning to strenuous activity, it takes a bit longer after the gastric bypass than with the sleeve. There's more long-term sort of follow-up and maintenance with the bypass. Malnutrition can happen. So if you're not taking multivitamins, you're not following a nutritionist plan for the food you need to eat, it can lead to longer-term complications. So with the bypass, which could be the better option for you, that's why it's important to have a consultation with the team to see which one is better for you.
Exactly. As we conclude, viewers, doctor, what would you recommend or what advice would you give anyone that's watching us that wants to reduce weight? What candid advice would you give them for someone who has gone through that journey? And a very risky journey.
Firstly, it's a psychological change, your relationship with food. There could be medical conditions that have causing you to put on weight. Don't jump to any doctor that is just going to say, we need to cut you and open you up and do a surgery. Surgery should really be your last option after you've tried all other viable options, diet, exercise. Those don't work for you, there's medical interventions available. It's a multidisciplinary approach, by meaning that it should involve your nutritionist, your physician, your surgeon. So it should be your last end option where the risks of not having the surgery are higher than the benefits. The benefits are higher than the risks because if you have the surgery, there's complications that can arise, long-term complications. So really be aware and be sure that this is what is for you, because you don't want to end up from the, what we call it, from the pot into the fire,
Exactly.
the melting pot. So need to really have that discussion.
Thank you so much, Dr. Chirag, for your time, and thank you so much, viewers, for joining us on our live session today. We have been talking about weight loss and in particular the gastric sleeve and bypass procedures. As doctor has mentioned, before you consider getting any of these surgical procedures, this should be your last resort. Make sure that you've tried all the other alternatives like going to the gym, dieting, maybe I think counseling, because
Counseling, yes, psychological interventions, those are important.
Psychological interventions for these for your weight loss. Tune in next time for another exciting topic. But before I go, remember to like, subscribe, comment on our YouTube channel.
Thank you. Bye-bye.
Thanks.
Good.